Hey YouTube, it's Wishby. I just videotaped this and it had no sound, so we're gonna try again. And it might be shorter because my thoughts have already been said. So with that said, hi, this is my 7th week. I don't know. Okay, I had surgery on the 17th of March. So yeah, so this would be my I mean the 17th of March. I'm like going crazy. 17th of August. So I'm either 6 or 7 weeks post-op. I'll write it. Yeah, I can't believe I'm still confused about the same thing I talked about a few minutes ago. But in either case, going back, I did weigh myself this morning and I was 226.5, and my highest weight was 282, and day of surgery was 264.5. So, and of course, as I explained before, the day of surgery, I mean the week of surgery was like wait, because I was supposed to have surgery like a couple of days. So a couple of days before I was 271, and because I was on a liquid diet, I ended up like losing a few more pounds. But in either case, I'm just gonna go by my highest weight because that's the number is higher, you know. So from 282 to like 226 is unbelievable, amazing. So that's the number that's better because this year I was 282. So believe me, this is incredible. I think this is the most weight I think I've ever lost. So this is great. Well, with that said, I, I'm doing good. I'm not doing great. I would say only because I've had issues with just like food getting stuck, and I think the dumping syndrome. I had a gastric bypass on August 17th. So I have had the effects of dumping syndrome because um, I do have issues with food, just like, okay, when you see the food, you want to taste it. And I'm definitely not hungry. So, I mean, for those of you who had the surgery, it's definitely not hunger. It's head hunger or just wanting to the texture and the feel of food. And my whole bright idea was to say, okay, since I can't eat it, I'll just like put it in my mouth, chew, and then throw it away. But what does happen with that is that a little bit of the juices will go down, and then that goes in your stomach. And then if it's something that is greasy or if it's something that your stomach can't take, it just definitely gets sick. And I tend to, another issue that I do have is like not chewing well enough. So I did try to solve that issue with buying the magic bullet. So I'm basically blending all the food that I eat. So that's been working a little bit. I'm even like putting it, in the thing once I mean it's crazy. I just wanted liquid. But in either case, that's and then also eating too much, which is still an issue because, like, let's say if I did blend my food and then I start eating, and God forbid, like, like if you're eating, like, you can't talk to people. If you're eating, you can't, like, you have to concentrate on the food. And that's something that's like weird to get used to, because let's say if I'm eating and then I forget and I swallow before I was ready. And even if it was blended, because it's like, let's say I put it in my mouth, and then I have to make sure that it's not too big going down. It has to be like a little bit at a time. So if and that has happened to me several times where I'm just like, oh, okay, blah, 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 and then forget and swallowed. Especially if it wasn't chewed enough and it was like, forget it. The food is stuck. The food is just like, I'm here and I need to get out. And I would spend 2, 3, 4 hours trying to get rid of it. And so that has not been pleasant. So those are some of the issues that I've had with food. Like I said, just eating the wrong food, thinking that I can eat something when my stomach is definitely not ready for it. I was surprised because, like when they give you that formula that says, 1 week out, you do this, 2 weeks out, you do that. Like, it sort of doesn't fit every mold. So because I'm still on soft food, I can sort of start to eat other stuff, but I'm still on soft food. Like, like today, like not today, this weekend, I made toast for my son, and I tried toast. And on Saturday, it was wonderful. I did toast for him, and I think I took a couple of bites. Made sure I chewed it very well and fine. And I definitely like the texture of Sony. Yes, I did put some butter on it. Um, I definitely like the texture of toast, and so that and that was something that I did find that I could have on Saturday. Now I got a little bit thing, comfortable, and then had it again on Monday, and on Monday it was just like so I think maybe I put too much. Now I put too much butter. So butter is not something that you can really have. So even if it was just like a little tiny bit, so I ended up like just being sick for hours, like most of the day, and not being able to drink anything even. So you sort of really, really have to be careful what you put in your mouth. Even if you say, okay, let me just taste this, it doesn't work that well. You have to make sure like the food is of a pure, healthier quality, and otherwise, like me, you live and learn, and then you pay for it. So, I mean, these are some of the issues, and with and then chewing well and making sure like you're concentrating on the food, and then of course like knowing how much to eat overall, because I think my stomach is so little, it's like ridiculous the amount of food that I'm eating. So and I had this I mean, I've said this before in the other video, but it's sort of ridiculous. So just these are the things that you have. And I did not get a scale, and I did ask my doctor like how big is my stomach. He did say, out of surgery was 2 ounces, so I don't think it went bigger than 2 ounces. So because like even when I drink water, I have to be careful not to drink too much. Even though now I'm getting to the point where I don't have to wait that whole full goddamn 10 minutes. Like you take a sip and you have to wait 10 minutes. I had to do that. Now I don't necessarily have to. I could sort of drink, like every 3 minutes. Um, huh. Well, and then, drink like a couple of like sips within 2 3 minutes, not just like take a small sip and then have to wait. And it's anyway, but these are like some of the things that you're dealing with the surgery. And of course, like I said, if somebody asked me like would I do the surgery again, I'm still like at a definite yes, because just a few minutes before I started the first video, not this video, so there's been 15 20 minutes now. But when I my son was asleep in my car. I picked him up. My son's like almost 40 pounds. So I went to the doctor yesterday, and he weighed in at 38 pounds. So I was able to lift him up, come up the stairs, because I live on the second floor, come up the stairs, put him to bed. And I was reasonably like not out of breath. I was okay. I mean, it wasn't like easy, but at the same time, it was easy. So like it would be easy for my husband, but at the same time, it was easy. And that's a wonderful feeling, because one of my biggest thing about having that surgery, I remember a few months, more than a few months ago, and back in February, March, I literally could not even walk my son to my car. And I would pause halfway, like just down the street or just a couple of houses down from us. I would pause halfway, had to stop. Sometimes I would be seeing black. So to be able to do that is like wonderful. Another thing is that, like I said before, my blood pressure is just like wonderful. Like I went to a doctor's visit last week, and it was like what is it, 70 something over 123. And before, I mean, like wonderful numbers. The CPAP machine for the sleep apnea, I have not been using it for the past 2 weeks. And, yes, I do have to go to the doctor to make sure, that it's okay. But at the same time, usually the symptoms, like when I wake up, I would wake up a lot in the middle of the night. And then when I wake up, I would wake up with very bad headaches, because I didn't get enough sleep. But I'm really, I've been sleeping without this machine, and that's like wonderful. I mean, there's so many things that are happening that because of the weight loss. Um, that's truly amazing. So I'm just like, I'm very thankful, and starting to see like the results, the real results that you want. I mean, not just saying, okay, I've lost a bunch of weight, but like all those pre like conditions that are just heading to to the road of no return of diabetes. But before I had the surgery, I was borderline diabetes. So just like you have the one foot there and one foot out, and you just keep hopping in and out of diabetes. So like right now, I don't have those issues, and it's wonderful to be here. And that's why even with the food issues and missing food, and I am and I would definitely have this surgery again. And and I would definitely recommend it to other people. So but this is where I'm at, like at 226. It's like, it's crazy. It's definitely like a lot of weight. I mean, I'm trying to think like how much that is, but I was at 282, so 226 is close to 60 pounds overall. Um, which by the end of this week I should definitely be. And I've been consistent with losing at least 2-3 pounds a week. And at the beginning, gosh, I was losing like 7 to 10 pounds a week. So but now at 6 weeks, it's slowed down a little bit, but not that much. Sometimes I do lose 5, 6, 7, 6 pounds a week. So I mean, within 2 weeks I usually lose about 10 pounds, give or take. Uh, that's amazing, just to see those diseases and being able to play more with my son and take care of my son and take care of my husband. Um, that's that's wonderful. Um, so it definitely goes beyond losing weight. It's like a whole change of lifestyle, because I am also going to the gym, and I've been doing Pilates, which is great. And all the aches and pains, like when you are overweight, you have like all these body aches. And I'm actually sitting here, and I don't necessarily, I'm trying to feel my body. There's nothing like, I mean, like when you are overweight, like you just sitting there and you like in pain, your knee hurt, like your back hurts, like you just, if you take like a survey of your body, like after a while you get used to like, living with the pain. And right now they're all starting to like go away. I mean, I still have some residue, but it's like it's all starting to go away. So definitely, if you are thinking about this, having the surgery, look into it, and take it seriously. And it's not easy. It definitely plays with your emotions. I do feel that I'm way more emotional now, and my husband has been, he's a patient person, and so he's been, very good with being patient with me and sort of understanding, like, a couple of weeks ago, he was like, well, what's wrong with you? You're just staring into space. And I had to tell him, look, I spend most of the day just literally thinking about what I have to eat. And it's crazy. It's like, if I have to, I would be staring into space and thinking, like, and I would have to be thinking about like, okay, how much protein did I have? How much protein I didn't have? Was it enough? Like, I need water right now because I feel it in my mouth. So all these things were just like over consuming me. And he was seeing me being spaced out, and he was like, what's wrong? So, um, and I had to sit down and explain to him, and then so I'm definitely going through like some emotions and some feelings, and so I think of also even some loss, because you like losing this whole part of your life where food was a big part of it, and it's literally no longer. I mean, I don't feel hungry, so I have to think about what kind of nutrition I'm putting in my body. Otherwise, I don't. I don't, because it's like the only really thing I feel is thirsty. So I could sit here and drink ice water all day, and that's it, and I'll be satisfied, because I'm definitely not hungry. So it's a whole different mindset that you have to think about food, and or I should say nutrition, because of the protein. And especially since I don't like the protein, and I also find that I only like things for a little time. So I went back to the shake today, and I liked it, but after when I first started, I didn't like it. So hopefully it's like a weird thing. But in either case, it's this video is longer than the first one. That's so funny. But anyway, this is, you know, where I'm at. So you know, definitely do your research. You know, it's important because when I started, I did do my research and I compared the surgeries and what's the best for you. I don't know, maybe I should have done the sleeve and be able to eat, but certain things after a while. But I definitely want this to be a permanent thing for me. So, like I said, the food is not the most important thing, like my health is, and seeing all these like success things like happening, blood pressure and sleep apnea is like going away. All these things are going away, and being healthy and fit and exercising again and being able to exercise again, because that was one of the things. You know, I was so tired and so sick, I wasn't able to exercise because I had no energy. Now I have the energy to exercise. So, you know, these things make it like you're making you lose more weight. So hopefully, you know, in the next few months I could get stronger and be able to exercise more. So those are my goals. You know, so great weight loss. You'll see the stats down below or on my page. So I will see you either next week or when I do the next video. Goodbye, YouTube. Aha.